So I'm George Crooks. I'm the Chief Executive of Scotland's National Innovation Centre for Digital Health and Care. And what we do is very similar to what a lot of people will be doing on this call. We are here to look to see how we can use next generation digital technology to address the societal challenges being experienced by our citizens here in Scotland. But at the same time as doing that, create new services that we can actually share with others around the world. Because the environment we're in now is increasingly challenging, and it's going to get more complex and more difficult as time goes on. So no one organisation, no one region in Europe, no one state is going to have all the answers. So collaboration is even more important now than it has ever been.
So what do we mean by shifting the balance of care? If you could just click on for a second, please. What we have is this. When we talk about having health services, we don't actually have health services. We have illness services. We focus most of our time and effort on treatment and post-event care. And we actually focus very little on prevention, anticipation, detection of illness, or independent living. And what we need to do is shift that focus. We need to invest more time and effort on prevention and detection, anticipation, and really support people to do the right thing, to better look after themselves, to make better informed health and well-being choices, and to live healthy, productive lives at home and in their own communities, connected to their families and those around them in a more meaningful and productive way. And I would suggest to you, technology is the way we can do a lot of that if we get the design right. Next slide, please. So for me, if we just click on, we'll just wait till this runs through and move forward. It would be no presentation in 2022 if we didn't talk about the global pandemic. But don't worry, I'm not going to spend the next 20 minutes going into the great detail about what we did well, what we did badly. But what I want to say to you is that it has totally transformed our lives, particularly in the use of technology. Who would have thought that digital technologies would become as ubiquitous as they are? If anybody said to me 2.5, 3 years ago that I would be celebrating family birthdays, Christmas, Easter, and so on, using these types of tools to link with my family, that I would be ordering very good quality food from some of the best restaurants in the UK and having it delivered to my home from my computer, I wouldn't have believed you. But all of these things have happened. These are our reality. So digital technologies are ubiquitous in day-to-day life, whether you're 20 years old, 60 years old, or I would even suggest to you 80 or 90 years old. But as we deliver healthcare, we're still not using digital technologies to their maximum advantage. So what are the lessons we really need to learn from the COVID pandemic as far as shifting the balance of care is concerned? And for me, there's two. First of all, we realize that it doesn't matter how good your policies are, or your strategies, or how well thought or considered they are, or even actually if you legislate to try to change behavior. The way the pandemic spread around the world was down to an individual's behavior. Your behavior and my behavior determined what happened to the virus in our communities. And that's actually really important, because what it means is that if we can support our citizens to make better informed health and well-being choices, give them the tools and services to manage more of their own care themselves, the vast majority of people will actively engage with that. And if by doing that, we can't simply use public money to deliver health services, but we develop new tools and services to create benefit, we can actually improve the economic situation as well. And this is what we call the health for wealth agenda. So what does this mean? Next slide, please. What it means for me is that it's all about money. Of course it is. But what I mean by that is that we need to recognize that the exponential increase in cost of delivering healthcare is not sustainable into the short, medium, and long term. It wasn't before the coronavirus arrived, and it's certainly not there now. So things need to change. Next slide, please. Also, before the coronavirus arrived, we were wrestling with these challenges: an ever-increasing older population, the inexorable rise of long-term conditions, and the burden it was placing, not simply on individual citizens and their families and communities, but in the health and care service. And we were just beginning to try to work out how we were going to do it. We haven't cracked it, and that problem stays with us today. Next slide, please. And then finally, if we layer on top of that, the global challenge we've got of climate change, which we recognize now is going to be a greater public health emergency for the world than that we ever experienced during the pandemic. And we've all got a part to play in actually trying to reduce the carbon footprint, supporting our governments reach their net zero carbon targets by being more intelligent and smarter in how we deliver health and care services. Next slide, please. So when we talk about shifting the balance of care, for me, we're really talking about integrating services to secure sustainability. We're not simply wanting to shift activity from secondary and tertiary care hospitals into the community. That's not what we're about. We're actually about transforming service delivery so that we're taking pressure off our formal health and care services. We're reducing the demand. We're actually creating capacity by activating our citizens. So when I led the Integrated Care Action Group of the European Innovation Partnership for Active and Healthy Aging with a number of colleagues who are in this event today, what we were talking about integrating care, we talked about vertical integration, which was the integration of healthcare from hospital into community services. But more importantly, we flagged up this thing which we called the horizontal integration of services. That is health and social care services being better integrated. But for a sustainable future, we need to stretch that horizontal integration further out and include the citizen, their community, and their family and informal network of care. And for me, that is the future. So when we're talking about shifting care, we're talking about putting the citizen, the patient, at the center of all we do. Now, every European healthcare strategy mentions that phrase, putting the patient at the center. But that's not enough, just saying it. That's just rhetoric. How do we do it? And we do it by actually not just saying that the patient is better empowered. What if the patient, the citizen, became the point of data integration, where everything was connected through the patient in a fully consent-driven way to allow the citizen to have control, to be able to access services on their own terms, to be able to make those better informed health and well-being choices supported by digital tools and services to do that. Could that make a difference? Maybe we need to explore that a bit further. Next slide, please. So when we talk about transforming change, shifting care, we need to look at three things. We need to look at technical or digital innovation. We need to look at service model innovation, that's transformational change. But equally importantly, and something we often forget, is we need to look at business model innovation. What is the underlying business models that allow us to deliver sustainable, affordable services? Next slide, please. Now, my organization has been doing digital innovation now for 8 to 9 years, and we've all got the scars on our back from making many, many mistakes. But what are the lessons that we've learned for designing for digital? I'd like to share some with you. Next slide, please. So for me, when we're looking at service design principles, we need to make sure that everything we do going forward is about predictive and proportionate care. Just because you can deliver a service using digital technologies doesn't necessarily mean you should. So let's be sensible and pragmatic. We need to balance our priorities a bit better. We need to get the balance right between the user, the patient and their family, and the system needs. As I've said at a number of events before, that 10, 15 years ago, 95% of the technology spend in healthcare was focused on the needs of organizations delivering care or the people working in those organizations. And the patient and their families were the passive recipients of that benefit. We need to shift that activity and need to invest more digital tools and services focused on the citizen, on the patient, to allow them to self-serve. Give them the tools to empower them to actually curate their own data and make better informed health service choices. So for me, when we're looking at service design, we need to be looking at citizen-activated services. The medical model of care, where the doctor and the nurse and the therapist was king, is over, and we need to recognize that. Next slide, please. So when we're looking about shifting care, we need to look at technical principles. We need to create data only once and use it many times. We need to trust in distributed data. No one provider will have all the answers. The days of single suppliers giving you end-to-end products is not affordable, and actually it's not good practice. And we really need to follow through on our political masters' rhetoric about personal ownership of data. And the European health data space is moving us in that direction. But we really need to put our shoulder to the wheel and drive this agenda forward for the right reasons. Next slide, please. So finally, we talked about business innovation, and business principles are really important here. We need to be looking at a future where we have open solutions that scale and evolve. We need to stop talking about products and start talking about services. We also need to serve the needs of the consumer, in other words, the patient and their family, as well as serving the needs of the commissioner, the organization, and the health and care professionals that work for these organizations. Now, that is going to take effective political leadership, sound strategies, but more importantly, an activated clinical community, be they doctors, nurses, therapists, technologists, social care providers. It needs the whole community to come together and to determine what needs to be done to serve the needs of the local community that we live in. Next slide, please. So when we're talking about next generation digital technologies, what do we mean by that? Next slide, please. We've talked about services, not products. Next slide. But here's a product. It's a product of the last 50 years of thinking. Like most of the wealthiest in the world, they take their wealth, be it money or be it in fact beautiful art, and they lock it up in bank vaults to keep it safe and secure. And that's what we did for many years in healthcare. We locked up our greatest expertise in things we called hospitals. And we now talk about hospitals without walls. But what do we mean by that? Well, a lot of people are actually taking hospital services and delivering those same services in the community. That's foolish. That doesn't reduce cost. That doesn't empower citizens. In fact, it actually often costs more and drives inefficiencies into your service. So when we're talking about hospital at home and shifting care, we're basically saying, how do we activate that person in the middle, the patient, the citizen, their community? How do we unlock the knowledge, experience, and resources that each and every one of us has inside ourselves and make that available to the bigger health and care system so that people can self-serve? Next slide, please. So to do that, we need to understand a few things. Now, if you look at the inside of that pie chart, you've seen that before. This is the social determinants of health, which is now accepted around the world as being really important and legitimate. And what it says is that your individual well-being and health and mine is influenced by many things. Only 20% of our wellness is influenced by the action of our formal health and care services. 30% is down to our individual behavior, smoking, exercise, what we eat, and so on and so forth. 10% down to our physical environment, our housing, and 40% down to social and economic and other environmental issues. Now, what we did in our organization in Scotland is we matched the available data points that we can collect in our citizens, and we matched them against the social determinants. And what it shows is that we are making health and care, life and death decisions on citizens in Europe today based on about 16% of the available data. What if we were able to take some of these other data points, some of the data points collected by the citizen themselves, or by IoT devices in their homes, or by data collected from smart meters and other sources, and made that available to the health and care system and to the citizen? Could that make a difference? Next slide, please. So for me, what I want you to think about is this. We need to blend citizen-generated data with formal health and care data to understand the true lived experience of citizens. And that will allow us to personalize services and make your life and my life better. Now, the global tech companies have been doing it for years. Amazon, Google, Apple, and others are personalizing services unashamedly for commercial value. But if we did it ethically in healthcare, if we personalize services for our patients, they're more likely to adhere and comply. They're more likely to be activated and empowered. But it doesn't happen by itself. Just as this picture shows, if you just stick a tap on a wall, turning on H for hot or C for cold, doesn't actually mean that hot and cold water will come out the tap. Next slide, please. Because what you need is this. You need the boring stuff. You need the plumbing behind the walls to make the taps work. And that means across Europe, we need to look at our ICT architectures and design them for the future, where we can layer next generation digital services on top of an architecture that also allows us to use our legacy systems at the same time. We're never going to get away with switching off all our legacy systems and building something shiny and new. We need a new environment, and that needs new thinking. Next slide, please. But we can do it. We have the technologies today to do that. It's not just a fanciful idea. And I'm not going to talk through this slide, but in Scotland, we have built this environment, which is a digital exchange, which links formal back-end public sector databases. It links new next generation tools and services. It allows us to bring in citizen-generated data from IoT devices. As long as there's FHIR APIs available, we can shift data. And today, we can take data from a citizen in their own home, and we can deposit that into the electronic health record or into the family doctor's record, and we can lift data from those databases and other databases, and we can move that into a personal held file held by our citizens. Now, we are running simulations and demonstrations to show the art of the possible, but believe it or not, the Scottish coronavirus test and protect system ran on this architecture. And we were one of the few regions in Europe where the contact tracing service was not delivered wholly by public health protection teams phoning people up and doing contact tracing. But using this environment, we allowed 70+% of our citizens to self-serve and self-contact trace, and they did it incredibly well. Should we be surprised by that? No, we shouldn't, because it was important to our citizens. They wanted to do the right thing. And let me just try and silence some of the doubters out there who said, you can't rely on citizens. This is too important. If you look at blood pressure recordings, the most inaccurate person to record a blood pressure is a doctor. We know that statistically. In the BMJ, there's a publication that showed the number of times a doctor wrote a blood pressure down that ended in a 5 and 0. Statistically couldn't happen. The next least reliable at collecting the blood pressure is a nurse. The most accurate person at recording a blood pressure reading is the patient themselves, because it's important to them, so they get it right. So let's activate our citizens. Let's give them the tools to do it. Blend it into an architecture like this to allow data to flow in a fully GDPR consent-driven way. Next slide, please. By doing that, we can shift care. And this is what we call the DHI exchange. So when we are shifting care, we're talking about exchange of data. Click on, please. So we're exchanging knowledge, we're exchanging ideas, we're exchanging data, but more importantly, we are shifting impact. We're focusing impact where it's needed, to the patient, to the citizen, to the community. Next slide, please. So this is my final thought. No one of us, as I said at the start, has the answer. When I show you this slide, I'm talking about collaboration. We all need to collaborate. And when I ask people what this slide means to them, they say, oh, look at that. The horse is saving the poor little dog. But actually, that's not what this slide shows. What's happening here is the little dog is telling the horse where to go to safety. And in healthcare, that little dog is the patient, the poor relation in the transaction of healthcare for the last 50 years. If we listen to our patients, they not only tell us what's wrong with them, but actually they can make their life and the way we're delivering healthcare much better, more effective, more affordable, better quality, and safer for all. Thank you very much for listening. I hope some of that was relevant and helpful. Thank you.